from Pakistan, working as assistant professor Hamdard Medical University Hospital and South City Hospital, and I am also a member of American Academy of Aesthetic Medicine. I am practicing in this field of dermatology for last 10 years. Today, I'll discuss my study with you regarding the safety and efficacy of secukinumab in moderate to severe psoriasis vulgaris. So a little bit about a brief intro, that psoriasis is a chronic immune-mediated inflammatory skin disorder with approximately 120 to 180 million people who are affected worldwide, and its occurrence is predicted between 2 to 11.8%. WHO documented psoriasis as a serious non-transmissible disease in 2014, and WHO report in 2016 put emphasis on better realization of the seriousness of the disease globally. Previous researchers particularly estimated the occurrence of psoriasis range between 0.27 to 11%, and as we all know that it's an inflammatory disorder, it is characterized by scaly red plaques over extensive aspects. So now it is regarded as a systemic disorder rather than a cutaneous disorder, and it is associated with metabolic syndrome, psychological upset, arthritis, as well as cardiovascular morbidities. Mostly psoriasis can arise at any age, but frequently it is more prevalent under 35 years of age. Generally, psoriatic patients are divided into two main groups. The one is mild to moderate and the other one having severe psoriasis. And it is based on the lesion covering the skin. So it's a multifaceted syndrome for which a variety of innovative remedies have discovered in last few years. Despite of the discovery of therapies, psoriasis remains a treatable but still not a curable disorder. According to mode of action, remedies treating psoriasis can be grouped into 5 classes: anti-interleukin 12 and 23 agent, anti-interleukin 17 agent, anti-metabolites, anti-T cell agents, and anti-tumor necrosis factor alpha. So the current therapies in 2021 that directly inhibit interleukin 17 pathway include the secukinumab, ixekizumab, brodalumab, and bimekizumab. But in Pakistan, only secukinumab is available right now. So the objective of my study is to assess the secukinumab for the treatment of psoriasis, but none of the researches have been conducted on large scale in Pakistan. That's why I have conducted this study for over a period of 3 years from 2018 till 2021. It was conducted to assess the effectiveness of secukinumab in patients with psoriasis vulgaris. So hypothesis, that null hypothesis include that there will be no effect of this drug for the treatment of psoriasis, and alternate include the effect of secukinumab for the treatment of psoriasis. It was a prospective interventional study. The sampling technique was non-probability convenient sampling. The sample size was 138. The duration of study was 3 years, and it was conducted in multiple hospitals, the three tertiary care big hospitals in our city. The one is Hamdard Medical University Hospital, the other one is South City, and the other one is the JPMC. So the inclusion criteria was adult patients between the age of 18 to 65 years were included with both genders. Those who were unresponsive to the conventional treatments. The conventional treatment of psoriasis include methotrexate, cyclosporin, and acitretin. So all of my patients have become unresponsive to the conventional drugs, or some of them have developed the side effect of the conventional therapy. That's why we have decided to start the biological agents in them. The other one, the patient included with treated with these secukinumab only for a minimum of 4 weeks till 52 weeks, having baseline PASI score of more than 10 at the initiation of the study. The exclusion criteria include those patients in which the drug was contraindicated because of the intolerable, or whether they are on other systemic therapies like methotrexate or cyclosporin. They have excluded from the study. Pregnant and lactating women are also excluded, and those who didn't give the consent. So after ethical approval from institutional review board, data collection was started, and these include the basic demographics of the patient, such as the age, gender, height, weight. we'll discuss in detail in upcoming slides regarding the demographic of my patients. Treatment was started with the administration of single dose of 300 milligram subcutaneous injection once every 4 weeks, and then it was followed up by once monthly till 52 weeks. Outcome measures of the treatment involved the PASI score, which is the PASI is the abbreviation for Psoriasis Area Severity Index, and we have calculated this score at the baseline and then at various weeks during the treatment. Its safety and tolerability tests were did, including the examination for any adverse effect, both mild and serious. And patients were followed up till 52 weeks. So this is my first case. He's a young boy, 32 years of age. He is having psoriasis for last 18 years, and he took all the conventional treatment before, and we have started this secukinumab, and the PASI score was very much increased at the time of initiation of therapy, and after 4 weeks, he developed clearance of all the lesions, and still he was sustained with the same response by the end of the therapy at 52 weeks. I'm sharing my another case, which is case number 2. Again, he is having erythrodermic and severe kind of psoriasis, covering almost all of the skin from head to toe. He is another young patient of 32 years of age. He is having psoriasis for last 8 years, and he is on antidepressant medications as well because of the disease. At 52 weeks at the end of therapy, almost all of the skin becomes cleared with this magical drug, and the patient becomes very happy and satisfied. This is my third case of, again, a severe case of pustular psoriasis. He is a young boy of 18 years of age, and he is also developing side effects of the other conventional therapies, and we started the biological agent, the secukinumab, and he again presents with significant improvement at 4 weeks of all the lesions from the skin from head to toe, and he is very happy and satisfied. The last case was a case with the plaque psoriasis, and again you can see the remarkable improvement at 4 weeks of this patient after starting the secukinumab therapy. So the statistical analysis SPSS version 20 was applied for the paired t-test frequency and percentage calculation and mean and standard deviation. The demographics of my patient include the age was the range of age was 40 plus minus 9.5 standard deviation. The duration of psoriasis was 7.95 with standard deviation of 4.85. Mean age of onset of the disease is 32.4 with a standard deviation of 10.54. There is male predominance in our study with a ratio of 4:1 from male to female ratio, and the psoriasis severity was the moderate cases were 39.9, and the the patient who have severe psoriasis were the standard deviation was 61%. This is the pie chart showing the gender distribution of male and female. So it is this table shows the overall difference of the psoriasis PASI score at the baseline and at different weeks of the duration of treatment. Like at the baseline, you can see the PASI score was 54 versus at the 4 weeks, the PASI score shows significant improvement from 54 to 4.42 at 4 weeks, and 0.28 at 12 weeks, 0.18 at 24 weeks, 0.04 at 36 weeks, and at 52 weeks it becomes 0 with a significant p-value of less than 0.001. This table shows the PASI score difference in moderately effective psoriasis patients. At baseline, the PASI score was 43, which was significantly improved at week 4, which becomes 3.9, and 0.18 at week 12, and becomes 0 in subsequent weeks at 24, 36, and 52, and go on, and with a significant p-value of less than 0.001. And in the last, this table shows the PASI score difference in patients having severe psoriasis. The PASI score was 61 at baseline, and again you can see this significant reduction in PASI score at week 4, which becomes 4.77. At week 12 it becomes 0.36. At week 24 it becomes 0.31. At week 36 it is near to 0, and finally at 52 weeks it becomes completely 0, with showing significant reduction in PASI score. So this is the graphical representation of the same PASI score. You can see that at baseline the PASI score was 61 in case of severe psoriasis and 43 in case of moderate psoriasis, whereas at 4 weeks there is significant improvement in PASI score, and you can see this reduction is continuous in upcoming weeks at 12, 24 and 36 weeks. It is near to 0. So the present study demonstrated that secukinumab has rapid mode of action, and strong and persistent disease clearance with a superior and comparable safety report in patients treated with moderate to severe psoriasis. A prospective cross-section study conducted in Lahore analyzed the study, wherein sample size involved 56 males and 31 females, thereby proved the male predilection in their study. So these findings were similar with our study, as in our study there is also male predominance, and showed that 112 were male and 26 were female, thereby proved male predominance. Interestingly, one of these studies conducted in Japan analyzed the efficacy of secukinumab in psoriasis and psoriatic arthritis as well, using PASI score. It was observed that mean PASI score was improved from baseline 14 to baseline from the baseline 2 to week 12. It becomes significantly improved to 1.78, which was sustained till week 24. So as far as our study is concerned, it was found that mean PASI score was significantly improved. So the limitation of our study, there are two limitations: the observer bias and selection bias. Observer bias means that it is an observer based observation, like PASI score may be different if you are having a different observer. And selection bias means the selection, it was a non-probability sampling technique, so it can be better if we use a sampling technique of a probability method, if we use a probability method convenient. So the study concluded that secukinumab has superior efficacy and safety with rapid onset of action, leading to clearance of moderate to severe psoriasis. Additionally, it was seen that secukinumab significantly reduced the baseline PASI score till 8 weeks and rapidly, and these effects were sustained till 52 weeks. Thank you so much for your patience, and thank you so much for your attention.
Thank you, Dr. Shahmoona. That was an amazing presentation. I am opening the platform for the participants if they have any questions for you.
Yeah, thank you. Thank you. Most welcome.
If any of the participants has any question for Dr. Shahmoona, you can please ask her.
And I want to say thank you for you all to organize this event and making me part of it, and sharing my experience with you all. And although I am very far, I was unable to attend physically, although I want to. So maybe in future we'll meet face to face, inshallah. And thank you again so much.
Thank you so much, Dr. Shahmoona, for your contribution towards this.